Okay, so you get the PowerPoints, right? Along with those PowerPoints, I send case studies. Okay, the case studies are in the purple. I'm going to share my screen for a minute. Oh, I don't want to end the meeting. Hang on. Dear Lord. Okay. Share my screen. These case studies, right? The ones that are in purple, right? Those, okay, those are the case study. That is the case study that comes from the instructor's lesson plan. So that's a really good case study to review. Okay, so I need you to review those. We develop a lot of the, I call it essential knowledge that you need for exams and questions. A lot of that information, the learning comes from the rationales in the case studies. Okay, so please have a look at those case studies. Okay, and then have any of you gone into Evolve yet? Like I sent you the updated directions to try and access your student resources. Has anybody tried that yet? You guys know what I'm talking?
I actually called them and they installed
Teresa,
it for me. Yeah.
And so you were the student I was referring to.
Yeah,
said,
and it was super easy too. They were
listen,
really good about it.
Can you explain to the group what you had to do? I put this in an email, but I want you to explain to the group.
Yeah, there is, if you scroll down to the bottom, it'll have like contact information and you call the customer service number and let them know what book we have and that you need the case studies and the resources for that book, and they'll install it on there for you. Okay. It was really simple.
So until everybody gets that done, I am going to continue to send you the 2 resources. And I did this weekend. Okay, so these are 2 other learning activities that are extremely helpful in understanding the concepts of community health. One is the practice application. These are 2 learning activities in every chapter. There are a few chapters that don't have case studies, but most of them do. One is the practice application exercise. Right, I sent you the answers, right, to all the chapters. Does anybody, does that sound familiar? Yes, no, what? Do you guys even know what I'm talking about?
Can you repeat that?
Practice application exercise in each chapter.
I'm looking through my stuff right now. I don't see it.
It should be in the what did I say? What did I send in the week 2 announcement? I sent the PowerPoints, the lesson plan case study. Did I send the?
Yes, you did. I got it.
Okay, so I'm going to the announcement. Sure, I did. Yeah, I sent.
Yeah,
okay, so here's all. Here they are, right here. Everybody should be able to see this. I'm sharing my screen. You got your PowerPoints. You got the chapter lesson plan with answers and rationales, which is the purple. And then I sent you the 2 resources that you will get when you do what Teresa did. These are in the student resources. It's a chapter practice application learning exercise. It's a learning activity in each chapter. I've sent you the answers down here. Okay, this is what it looks like. Let's do chapter 18. Okay, so if any of you who haven't opened it, this comes right from Evolve. Okay, answer key for practice application questions. That's in each chapter. Okay. And the reason why I think these are excellent learning activities is because it gives rationales again. And as you know from last week, I am a firm believer in rationales. Okay, I think they're excellent. Okay, so sorry, I didn't mean to get out of that. So that is your practice application that I sent in. Okay, so I sent you all the PowerPoints, all the lesson plan case studies, all the practice application answers, and I'll show you where those are in their chapter. And then in each chapter, or most chapters, they have another case study right in the chapter. Okay, and I've sent you the case study, which has the answers. And again, it has the rationales. Why are answers correct and why are they incorrect? Okay, I cannot stress enough. I'm not just sending these, it takes me a while to put these together. Okay, I'm not just sending it to you for more work to do. These are what I think are the key learning opportunities for each chapter. Does that make sense? And it's not a lot. I mean, you don't have to go in and read every chapter from start to finish. If you do a few of these case studies, if you take a look at the objectives in the PowerPoint, if you do the couple of learning activities in the chapters that I'm giving you the answers to. So Teresa, you should already have access to what I'm already sending. In your
Yeah, I
Evolve
do.
Resource. Yeah. But until everybody gets to do what Teresa did, I'll continue to send you those practice application keys. Okay. So let's go real quick to, so hang on before we go anywhere. With all that said, what has anybody done so far to prepare for this week's lecture, which is a review of 8 chapters, 1, 2, 3, and 21 from last week, 18, 19, 20, and 31 from this week. And then you got the study guide this week. So what has anybody done to prepare? Please be honest. So I know what I'm facing today as far as preparation.
I'm going to be honest with you, with the workload that MedSurg 2 has given us, it's been really difficult to focus on any other classes.
Okay. Yep.
I have been sleeping most of the week because my whole house has COVID.
Oh,
I'm finally starting to feel a little better though.
no, we just got over it. My family.
Yeah,
We
it's
had
my
it over-
second time having it.
Oh, we got it over Christmas. All of us. I'm sorry. Feel better.
Thank you.
Anybody done any reading or preparation?
I glanced over the PowerPoint. Week 1, I went over like 1 chapter. That's about it. Okay. To be honest.
Okay.
I read the chapters, but I always do I don't read them. I just I do what you told us to do, like with the objectives, but I read it really, really fast. Like with my finger, I kind of just go back and forth.
Okay.
But I look over the PowerPoints too, but that's about it.
Yeah. So the expectation for each chapter is that if you can answer and articulate the objectives, you're going to see that the same information that you learned from the objectives. That's what's going to be on the study guide, which then in turn, the study guide, as I said, is a good representation of the essential knowledge that you're going to be tested on. So it's all connected. Okay, so as you start to prepare for studying for the exam next week, I don't need you to go back and read every chapter. If you took notes of what I just said for the last 10 minutes, that's what you need to focus on. And we'll go through each chapter real quick. We'll try to get through each chapter. And I'm going to show you where this information is. Okay, so hang on, I got to share my screen. Oh, has anybody taken a look at the study guide yet?
Yes.
Lewis.
I just printed it out.
Okay.
I did, yeah.
Yep. So my suggestion with the study guide is that as you go through each chapter and figure out the answers to the objectives, go to the study guide and highlight what you've already been over. Because based on the objectives and the answers to the objectives, all the information from that is in the study guide. Does that make sense? I'm just trying to connect all the dots for you all so that you don't get overwhelmed. Okay, it's a pretty simple process.
We are already overwhelmed.
Well, I mean, I know, but you're taking 3 classes and you need to pass this class to move on.
I know it.
But that's why I said last week, you know, in all fairness, I really would hope that you would just take this class and look at it as just kind of a change of pace, you know, out of the acute care setting into the community. There's not a lot of work in this class. There really isn't. So number one, don't blow this class off, right? If you end up doing poorly on exam 1, it just kind of follows you the whole term, right? Because like Karina's shaking her head, you only have four key graded assignments, and that's 3 exams and your HESI. I mean, everything else is graded, but it doesn't come into play until the end, assuming you're above a 78%. So, you know, I'm trying to not minimize, but I'm trying to direct you and focus you in specific areas. And if
I was doing sorry, I did not mean to cut you off. I was doing
that's
the
okay,
question.
who's this?
Elizabeth.
Hi, Elizabeth.
Hi, I was doing the questions on evolve, and I would say 60% of those questions were select all I apply. Is the exam going to be like that?
No, the exam's not going to be like that. There are several select all apply questions. I don't know, it's 60%. Okay, so all right, so this is good to know. Elizabeth and Teresa, I'll ask you as well. The other student resource you have in Evolve is your 10 review questions for every chapter. Right? That's what Elizabeth's talking about. And they're excellent. That's another resource, right? I can't send you those because when I go into student resources and see the review questions, I actually have to take the exam and I have to wait till I get all 10 right, which, you know, I'm usually up to 8 or 9, but I have to go back and take it in order for them to spit out the answers, and the answers come with the rationales. And Elizabeth, I don't know if you've noticed, but those 10 questions provide an incredible amount of knowledge, the rationales. Would you agree, Teresa?
They
Yeah.
do. Honestly, the whole Evolve thing has been helpful with other classes. It's
Yeah.
a great resource.
The student resources in Evolve.
Yeah, great
Yeah.
resource.
Yeah. So I would suggest for all of you that in the next couple of days that you pick up the phone and call Evolve and get them to register you. As Elizabeth or Teresa said, it's a really easy process and it doesn't take much time at all. And get access to those student resources. And we've talked about 2 of them already, the practice application. Let me show you. I'm just trying to help you out here, guys. It's a team effort, okay? Let's see, let's get me into my Evolve. Bear with me. I'm not a tech. I already told you all this, but all right, so Evolve. Okay, go to your books. So here's what I see when I get into my Evolve. I see instructor resources and student resources. Instructor resources is where I get that case study that I send you. That's in with the purple highlights. That's where I get my case study. But here's your resources. Okay, so let's just go to, it goes through all the chapters. Let's just go to 1. You have key answers to practice application questions, which I send you. Right, Teresa? Elizabeth? Does this look familiar?
Yes.
Okay. You have your case study. Both of these are in the book. These are in the book. These are student learning activities. And then you have these. You take a quiz. Okay, you take a 10-question quiz. And when you're done, it's going to send you what you got correct and what you didn't get correct, why you got it correct, and why you didn't get it correct, why the answers are correct and why they're not correct. Elizabeth, Teresa, right?
Yes.
Okay.
It's amazing. It goes over all the key terms, all the definitions, all of that is in there.
Exactly. Exactly. So, guys, I don't know what else to tell you. I've given you the things that you need to study. It doesn't, you don't need, go ahead.
So you just call Evolve and
Yeah,
ask for help.
I put it in the announcement. It's in an announcement, right, guys? I put in an announcement.
I have the phone number if you guys want to write it down.
You want to put in the chat,
Yes,
Teresa?
please.
Yeah, I can do that.
Or do you want to say it and then put it in the chat?
Yeah, no problem. It's 1-800-222-9570.
It'd be worth your time.
It was so easy. It was much easier.
Thank you.
You're welcome.
Teresa, put that in the chat, please. Okay, I just want to go into
I
a
will.
chapter. Okay, so just real quick, you have your chapter 1, right? You go to your objectives. So by reading these objectives, what do we think we need to know? We definitely need to know the difference between community-based nursing, community-oriented nursing. We definitely need to know what's the role of the public health and nursing in population health. Okay, what are the core functions of public health? So there's 3 objectives. Okay, so now actually, if you go, oh boy, am I sharing now? Can you guys see this?
Yes.
No,
you are.
So if you guys go into the PowerPoint that we just did, so there's your objectives. Well, in PowerPoint 3, there's one of your answers to your objectives, right? These PowerPoints are outlines, and they have pulled out the key information. And since most of you have not reviewed any of this, it doesn't make sense for me to go over each of this. It really doesn't. I'm just trying to get you in a place where here's what you need to go study. Okay, what is public health? Okay, that's another objective. Okay, what are the core functions? Here they are. Oh, sorry. Here they are. Okay, and slide 6. Okay. What's population? You can keep going through. What's population focused nursing? Okay. Does that make sense? So you are going to find the answers or the information to review and be responsible for right in the PowerPoints. If you can't find the answer, where do you go? Where, if it's not in the PowerPoint, where do you go?
The book.
Exactly. And I'll show you, I'll connect that dot with the chapter 1. Okay, here's population focused nursing. Okay. So again, you don't need to know be responsible for every slide on every PowerPoint, but you do need to be responsible. The expectation is that you understand the objectives. Okay, so with that being said, let's go into the book and I'll show. There's a couple of things there's 4 things that need to be reviewed in every chapter. I've already talked about 2 of them. What are they?
The chapter outlines.
The practice application and the case study. Okay, the objectives are the same. These same 4 objectives are the same on your second PowerPoint slide. Same thing. Okay. So let's go find let's go to the book and find what are the core functions. Okay, so if you don't understand, if you need more information, you can go to core functions right here, page 4. What are the core functions? I mean, in the PowerPoint, it just lists what they are: assessment, policy, development, assurance. Well, what does each one of them mean? Okay, up here, table 1.1 meets, I think, objective number 2. What's objective number 2? Okay, so number 3, contrast community-based nursing with community-oriented nursing. That's huge. There it is right here. Page 2. It's in a box. Basically, the way I remember community-oriented nursing versus community-based, I think a community-oriented nursing, that's typically what public health is called, where you're looking at the community as a whole. You're trying to orient yourself to the community. All right, so this is what you need to know here. The primary focus is on both of them. Okay, primary focus for community-oriented nursing is on the healthcare of individuals, families, groups, and community or populations in the community, with the goal of preserving, protecting, promoting, or maintaining health and preventing disease. So this is more of a preventative, more of a primary, more of a public health role. Okay. If you're working in the community-based setting, okay, this is much different. The way I think of it is you're based in the community. You're already based in the community. You're working in the community. Okay, you're focusing on illness care of individuals and families across the lifespan. Okay, you're managing, so you're taking care of the ill, managing acute and chronic conditions. So you're already based in the community. That's how I think about it. You're already based in the community, taking care of the ill. Whereas community-oriented nursing, your goal is to preserve, protect, promote, or maintain the health. Make sense? Okay, let's go back to another objective. We did the core functions. What's the role of the public health nurse? Okay, there's a whole section in here on the role of the public health nurse. Okay, here's number 4, population. Here's objective number 4, population focused nursing. It's in your PowerPoint, but if you want to read more about it, understand more about it, go to the book and read that section. Okay. So again, I'm going through here. Okay, the other, we'll find where the role of the public health nurse is, but the two boxes that you need to find in every chapter and be familiar with are, other than what we've talked about, are Healthy People 2020. Okay, I don't know if anybody's been on their website. It's an excellent website. Okay, this was established, I believe, 1979. And in each chapter, it has goals and objectives for whatever the topic is we're covering. Okay, so in this chapter, it's just overall, what's the overview? What's Healthy People 2020? Right? In another chapter, it's what are their goals and objectives with regards to disaster management? Another chapter, what are the goals and objectives regarding school nursing, regarding vulnerable populations, regarding environmental risks? These are all just topics we're going to go, or chapters we're going to go through. So Healthy People 2020 has goals and objectives for each chapter. Okay, you need to be aware of those. Okay, here's a really good section on understanding community-oriented nursing, which is population focused. Okay, here's your case study. Okay, we've already been through this, but here's your case study that I've already sent you the answers and the rationale to. Okay, answers can be followed on Evolve website. I'm already giving them to you. Take a look at these case studies. They have excellent rationales. Okay, I want you to know this. Please know this box. Quality and safety education for nurses. Okay, this is the QSEN competencies. Okay, whether you have to put that in a card, I don't know. But you need to know these 6 QSEN competencies. And then the other box I want you to look at in every chapter we're going to talk about extensively are levels of prevention. Just like Healthy People 2020, public levels of prevention are identified in each chapter, depending on the topic we're covering. Okay, so give me one word that describes primary prevention, secondary, and tertiary. Although you may not know this if you haven't done any reading or review. So let me make it easy for you. The one word to
Primary is like a vaccine.
Yep.
Secondary is like screening.
Yep, perfect.
And tertiary would be basically treatment and management of the disease after diagnosis.
Awesome. And who is that that's speaking?
Chisa, Cordy.
Hey, Chisa,
Hi.
thanks. That's great. That's great. So primary education, prevention, like a vaccine. Okay, look at what it is here. Develops a health education program for a population of school-age children and teaches them about the effects of smoking. Okay, so primary, always going to be education, prevention. And you have to be able to apply these to each topic we're talking about. And you've got to go through these in each chapter of the book. Secondary, screening. I also think of secondary as early identification, early intervention. Okay, so the public health nurse here provides tox screenings for migrant workers who may be exposed to pesticides. Okay, and then tertiary. They already have the illness, they already have the disease. We're trying to help them manage it, control it, stop the spread, stop the progression. Okay, they already have it. So now we're helping them manage it. Could be a stroke patient recovering from a stroke. Here are examples. The public health nurse provides a diabetes clinic for a defined population in a low-income housing. Okay, this group already has diabetes. So they're trying to have a clinic to maybe help them manage it better. Okay. So levels of prevention and Healthy People 2020 are non-negotiable for each chapter. My suggestion is that you also review the case study and if I come up and say, any boxes would be helpful, this one. Okay. Not mandatory, but I've highlighted it, so you should know it. Okay. And then here's your practice application. It's usually at the bottom of the chapters. Answers can be found on the Evolve website. Okay. I've already given you the answers. Excellent. These practice application activities are excellent. Do it with yourself. Okay. Let's jump to chapter. I am mindful of the time here, so don't worry. Let's jump to chapter 2. Oh, actually, I want to go back to chapter 1, case study. So here's a case study. So after you've answered the objectives, after you've done the learning activities in the book, go to this case study. This brings it all together. Okay, and this case study actually has an excellent rationale for community-oriented and community-based. And it's right here in the first question. All right, so let's do this real quick, just so I could show you how I think that this would be most helpful. So we have a student nurse on her community health rotation. She's working. See, I think case studies and rationales are as close to hands-on learning as you're going to get. Okay, so she's a registered nurse and she's in a rural health clinic. Okay, the large population of migrant workers and young families. Majority of the clients speak Spanish, which is Rosalina's primary language. So during her time in rural health, she learns that access to health care is a concern because of the cost of transportation. Another issue among the migrant population is continuity, because workers tend to move around doing seasonal work. So, and here's the question. I don't care that we can see the answers, okay? Because we're going to have to get the right answers anyway, but I want to get to the rationales. So the public health nursing care that she would expect to experience in the rural health. Okay. Nurses that are culturally diverse. Yes. Treatment that's aimed at preventing illness. Yes. Promoting wellness. That's what rural nursing is. And education aimed at behavioral and mental health issues, as well as substance abuse. Okay, well, if a lot of that doesn't make sense to you right now, read the rationale. It goes through community-oriented and community-based. Both community-oriented nurses, community-based nurses must be aware of cultural diversity and provide care that is appropriate to the client. Community-oriented nursing, such as that, so it goes through all that. The goals that are prevent disease and preserve, promote, restore, and protect. We just went through this. Where have you seen this? Right? This is a review. Although care is delivered with regard to funding, the migrant worker population would not likely receive Medicare benefits. Additionally, referrals to acute care facilities would be avoided if possible because of lack of funding. Okay, let me also tell you that a lot of our exam questions are really focused on primary, secondary, and tertiary. Okay, so we have to have a good understanding of those and be able to apply them in different settings. So here's a question. What type of primary prevention activity would she expect to encounter in a rural health clinic? Well, what's primary? Is primary tox screenings?
No,
Is primary doing a diabetic clinic?
no.
Okay. Is primary maybe a health education program?
Yeah.
Okay, let's go and read the rationale. Because the rationale gives a great synopsis of why A is the correct answer and why B, C, and D are not. So the development of a health education program is a primary prevention activity. Providing tox screening for migrant workers is secondary, and implementing diabetes clinic is tertiary. Okay, so it makes sense. Let's do the last one. Okay, one of the core public health functions is assessment. Okay, this is one of the objectives. What are the core public health functions? It's assessment of the health status of the community. Which of the following questions might be asked during the assessment phase? Think of your ADPI. Okay, ADPI is applied to community nursing. It's applied to public health nursing. It doesn't look the same. It may look a little bit different than your pediatric patient in the hospital or your elderly patient in the assisted living facility. ADPI is always applied. It's a nursing process, the foundation for the nursing process. So we, in this class, have to be able to apply it to the community setting. Okay, so which of the following questions would be asked in the assessment? What programs are available to reduce the risk of cardiac disease? No. What educational materials are needed? No. What is the prevalence rate of hypertension among various age, race, gender groups in the community? Well, that's kind of a confusing one. Let's go read the rationale and see what it says. The core public, now, if you just, okay, so if you just looked at the PowerPoint of the slide that said core public health functions, and it said assessment, what are the other two? Sorry. Assurance, assessment, and what's the second one? Somebody go back to the PowerPoint and look at the, oh, let's go back and look. Assessment, assurance, or policy development. Okay. Okay, so core public health function of assessment includes the collection, analysis, and dissemination of information on the health or health relevant aspects of a community. Okay, and it explains to you why these other answers are not correct. Providing programs and educational material are essential services to public health, but they're not part of the assessment phase. And advocating for public transportation is in the assurance. So if you went back and just looked at the PowerPoint here, you should be a little bit more curious as to what each one of those means, right? So in that case, what are you going to do? You're going to go to the book, right? And see up here at the top, I think we saw it at the top, right here. Well, if you took a look at those, you would know what assessment involves. And the answer was C to number 3. Does that make sense? This is all connected. All of this is connected. The PowerPoint's connected to the chapters. The case studies are connected to the chapters. Can you see all that? Can you see? I'm just going to stop sharing for a minute. Can you see how all that is connecting? I don't know, I'm asking.
Yeah.
Is this helpful to go
Yeah.
through it like this?
Yes.
It is.
Yes.
Okay. So, one of the chapters I really, you're going to have to, you're going to have to do it, but one of the chapters is, I think it's, no, yeah, please review this chapter well. Health risks across the lifespan. There are numerous questions on the exam about health risks across the lifespan. Okay, and look at all the objectives. All right.
Which chapter is that?
20. I mean, the exam covers all the chapters, but one of the core concepts, learning objectives in this class throughout the whole term is we in the community are going to be caring for. Can you guys see this? Did I share my screen or did I just jump on here? Oh, sorry. I didn't share my screen, so hang on. 20, 19. Right here. Okay, so chapter 20, health risks across the lifespan. Think about what we do as community nurses. Okay, well, take a step back. You have your peds class. What are you doing in peds? You're taking care of pediatric patients. Your clinicals are in acute care setting, right? In community health, you're going to be taking care of everybody across the lifespan. So we're talking infants, children, adolescents, teenagers, adults, special needs in the community, vulnerable populations in the community. Okay, elderly. And we're going to learn about what we're doing with all of those different populations. So look at your objectives for this chapter. What are the major health problems of children and adolescents? Right? What are the nursing measures to promote child adolescent health in the community? What are the risk factors for men and women's health? What are the risk factors for older adults? Okay. And here's the populations that we're talking about. Children, adolescents, adults, older adults, special needs. Okay, and then it starts to, you can probably answer numerous objectives. Start here at the PowerPoint. Okay, the next slide is children's health, major public health. All right, major health issues among children. Okay, target areas for prevention for children. Okay. So every slide on a PowerPoint is not part of the objectives, but you have to go and seek out the answers to those objectives, whether it be from the case studies, the practice applications. I think what Teresa and Elizabeth are saying is a lot of this information is in those 10 review questions at the end in the student resources. Teresa, Elizabeth, you want to add to that? Are they? Elizabeth?
Oh, yeah, sorry, I'll mute.
That's all right. Teresa, you guys want to add to that? About these 10 review questions at the end of every chapter in your student resources? They cover all of this? Or a lot of
Sorry,
it?
I was muted.
That's all right.
They're very important. That whole evolve thing, if you have a hard time reading the online book or anything like that, is super helpful.
I've used it to study for other classes in their exams too, the quizzes for the end of the chapters and stuff, and it has been very helpful.
Yeah, same here.
Exactly. So, all right. Do you guys, I'm not going to go through any more chapters because I want to be mindful of time. I want to get to the study guide and go through that. So are we aware of at least my suggestions, my encouragement for how to go about this? And try not to overdo it. Don't go back and read every slide of every PowerPoint and every word in every chapter. You're going to get too, pardon me, you're going to get too overwhelmed. And it's not going to work. Okay, everybody pull up their study guide. Okay. I started doing this last term like this because I did, when we did all of our extra review sessions, nobody was coming the last couple of terms. I mean, you guys just had too much to do. You didn't have 2 extra hours during the week to go to an additional community review. So last term I tried to, how could I ensure that everybody gets at least some kind of review, even if it's for an hour. And that's about all my extra reviews were taken, about an hour and 15, 20 minutes. So I decided to check with the group, student groups last term. I taught 3 classes and said, what do you guys think about the week before the exam? So week 2, week 5, week 8, that we spent the second hour of lecture doing the study guide. And they were all over it. And I thought it was a good experience. And so I've continued that this term. Okay, this way I know everybody's getting some kind of review and everybody knows how the study guide is set up. Okay, so what else about the study guide? 45 questions, and then 46 through 50 are typically math questions. I've sent you guys math resources. Has anybody taken a look at them and found them helpful, not helpful? My group yesterday, several students had already gone in to the math resources I sent and found them to be very helpful. Do you guys have any input? Has anybody looked at them? So if you
I've looked
haven't,
at them. I think they're gonna be helpful.
yeah. So if you haven't looked at them, I would definitely have a look at them if you struggle with math. I find though that this is my second year in community with you guys already having pharmacology. I find that for the very most part, my community students do excellent in the math. And if you're a student that struggles with math, we got to figure that out, okay? Because you're going to have 5 or 6 math questions on every exam. Okay, so reach out to me separately if you're a student that struggles with math. Oh, I know the last 2 terms there's been a lot of math tutoring, math classes going on campuses.
What kind of math questions do you
Okay.
think are gonna be on the exam?
So they're right here. Okay, so they're right here on this front page. So let's just keep going. Chapters will be 1 to 3, 18 to 21, and 31. 50 questions, multiple choice, select all that apply, math. 75 minutes. What do you want to review with math? Right here, Teresa. IV calculations, determining equivalence and converting between systems of measurement. Oral and parenteral medication dosages for children.
I think the children one is the one that gave me a little bit the dose by kilogram or kilogram.
The conversions.
Yeah, no, I know how to convert. Is like I know how to do the math to take the pounds to kilogram and then multiply by whatever the dose is. Where I have a problem with is when they're asking about how much they need 24 hours or they get in every 6 hours and then it starts.
Well, that's IV.
I want to give you 2 numbers
yeah.
for the range. So
okay, those are in the resources. The other thing you guys have access to is calculating with confidence. Have you seen that resource? Karina's shaking her head. Where'd you find it, Karina?
We have the book. So
Or all you guys have the book?
Yeah.
Okay, calculating with confidence is an excellent resource. Okay.
It's hard doing the math or refreshing because a lot of the stuff, like I learned dimensional, I do better with dimensional math.
Mhm.
And then a lot of the resources aren't dimensional and it's like Chinese to me.
Well, maybe start with the resources that I'm sending you. They're pretty basic. And I came upon a few more resources this week that I'll send out you guys. Okay. But the math questions, they're pretty general questions. Like, in order to be a nurse, you need to know how to do IV calculations. You need to determine equivalence. You need to be able to convert. I know a lot of it is already set up for you, but in the event that something happens, you have to be able to manually do all these calculations. Make sense? Let's see. We already talked about case studies, reviewing case studies, assessment and prioritization, management of care. Remember, safety is always first. What's the priority? Prevention levels. Here, prevention levels for each chapter. And the nursing process, which is what? ADPI, right? Right here. Again, levels of prevention. All right, levels of prevention. Healthy People 2020 levels of prevention. Okay, this isn't an all-inclusive study guide. However, helpful hints. We've talked about this all today. Best practice today for you. Best practice to prepare for the unit exam is to review your notes, weekly recordings, which I post. This needs to get taken out. We don't have interactive lectures anymore. I'll get that taken out for next term. Review readings, projects, discussions, review your weekly Zoom sessions, your recordings, attend a review session, which I'm doing it during class, right? And then reach out for tutoring, and also reach out to your campus staff as well. So we'll just review some of this. It's broken out into top key nursing concepts. First is priority and safety. Key concepts using ADPI, safety and delegation principles. So let's just take the first one and let's think about, if you were going to get a question about this, what would it be? So let's see, risk factors. So this is saying we need to know risk factors for SIDS include prone or sideline position, sleeping on a soft surface, maternal smoking during pregnancy, and it goes through 3 or 4 more. What kind of question might you get with that?
Select all that apply.
About what?
The
Tell me
risk
what the-
factors for SIDS.
What?
The risk factors for SIDS.
Yep. Select all that apply. Maybe, I don't know, or it could say pick the best, pick the one answer. I don't know. Right? Again, here's another one. Healthy People 2020. Okay, when you get Healthy People 2020 questions on the exams, it's not asking, in addition to Healthy People 2020, what do I think it should be? What do you think it should be? It's asking what Healthy People 2020 is. Okay, Healthy People 2020 is kind of big picture. There's lots of different goals and objectives that we could add to each and every list in every chapter. But when you get Healthy People 2020 questions, please make sure that you're only answering the correct answers that are Healthy 2020. Okay, so review 2020 principles on safety for adolescents. Look at violence, weapons, drug use, alcohol, and motor vehicle concepts. Remember, these are the leading causes of morbidity and mortality for adolescents. What might you got a big statement in there. These are leading causes of morbidity and mortality. What is? Violence, motor vehicle accidents. Make sense? So as you read each bullet, think about what do I need to know? What do they mean? Okay. Let's look at that one. Review concepts of prevention, which is primary, secondary, tertiary, when it comes to smoking and children diagnosed with asthma or chronic conditions, meaning asthma. How would you do a primary and tertiary prevention? So what would you guys do? What's a primary prevention?
Teaching healthy
Education.
diet.
Smoking.
Smoking and exercise.
Yeah. And then tertiary would be something that I would do in my school nurse job, which would be kids that already have asthma, teaching them how to use their inhaler correctly, right? How it's supposed to be used because they already have the asthma.
How to avoid triggers.
Exactly. Okay, this is important right here. Understand the difference between primary, secondary, tertiary, and be able to distinguish between the three and give examples of each. Okay. So that was the first section, priority and safety assessment. Okay. Second section is acts and organizations that play a role in public health. Okay. I already showed you where you can find your quality and safety education for nurses, right? That box that we highlighted in chapter 1. And these are from chapter 2. It wants you to know what FMLA is. What is the American with Disabilities Act? What's the purpose of Healthy People 2020? How does it impact the objectives for school nursing? Review the focus of frontier nursing services. Okay. And then I highlighted this here because this is four different organizations that play a key role in public health. Know the CDC, right? So you're going to have to go back to your PowerPoint or your book and find out what each of these does. Know CDC. Well, it says it right here. Focuses on protecting public health through research and education. And this is important. CDC, if you're asked, let's say you're asked a question, I don't know if this is going to be on there or not, but what agency provides the most guidance to public health, right? What do we rely on? Well, what have we been doing during the pandemic? Who's been calling all the shots for the pandemic?
CDC.
Exactly. So CDC provides the most current guidelines for public health nursing. Well, we sure have seen that over the last 2 years, right? Okay. And then another organization we need to know about is the WHO. What's the WHO? Supports global health. What's the NCHS? Focuses on data collection related to population demographics. And the fourth one in here is this one. So maybe with this particular paragraph, what kind of question might you get? Maybe given a scenario and you're asked which organization would take the lead role. I don't know. Like if you say, a global vaccine effort around the world. Well, obviously that would be the WHO because that's the only international program here. CDC is federal and CHS is federal and the Institutes of Medicine are federal. Okay. This is all the highlighting I did with the group yesterday, so I should have erased it, but what's the difference between advocacy and social justice? If it's on the study guide, you need to know it. Primary goal for public health, what is it? Here's all of the population-focused practice, community-oriented nursing, community-based nursing. Okay. So the reason why I should erase my highlighting is because I don't want you guys to focus just on my highlighting. Do you know what I mean? You need to know what's on the study guide. So I had one student tell me that a couple of terms ago. Well, I only studied what you highlighted, so I thought that was the important parts. No. You need to know the study guide. There's some important information in the study guide. The population of the world this is a pretty big statement. Population of the world is increased. Why is population of the world is increasing due to increased fertility rates and decreased mortality rates? People are living longer due to advances in healthcare, vaccinations, screening tools, medications. It could be a question out of that. Why is the population of the world increasing? Pick an answer. Or why are people living longer? Advances in healthcare, vaccination, screening tools, medications. You understand how to look at this study guide? Does this help? Just think about, what are they asking? Oh, here's your more community-based nursing. Okay, this particular paragraph goes through what is community-based nursing and what is community-oriented nursing. Okay, the next section is school nursing. It says right up the top, review Healthy People 2020 objectives for school nursing. So you need to go find that box in chapter 31. You know how to do that, right? Whoops. Oh, I need to mute you guys for 1 second. Need to hang. I just said you guys know how to, oh, no, I don't want that. Let's see. Let's go down to, I think it's in part 7, chapter 31. Yeah, the nurse. So in the PowerPoint, it said, review Healthy People 2020 objectives for school nursing. Okay. So let's go find that, chapter 31. Again, you don't have to read the whole chapter. Look at the original objectives. Here's your Healthy People. Here it is. Page 546. Okay. That's how you go in and find it. Healthy People 2020 objectives are related to school health and school nursing. Increase the proportion of elementary, middle, senior, high school kids that provide comprehensive school health education to prevent problems. And it goes through what kind of problems. Maintain vaccination coverage, increase routine vaccinations, reduce the number of school days missed by kids with asthma. Okay, so if that's on the study guide and you can't answer that, you'll have to go back into the chapter. So we just went back in and found that Healthy People 2020 box. Okay. Here's your discussion question this week. That's why we had you do teaching plans during, if you've already done it, you know this, but if you haven't, that's why we want you to do teaching plans with whatever 3 common childhood ailments you picked, right? Because we want you to start thinking ADPI. What's primary, what's secondary, what's tertiary? Okay. Family assessments, we didn't get to do a lot of this, but that's chapters 18 and 19. 18 and 19, family development, family assessment, and then 19 is family health risks. Okay, and that's what this section is. Okay, whoops, what did I just do? Oh my God, you guys, what did I just do? Okay, here we are. What's a family crisis? I'm going to keep all this highlighted because this is what I highlighted yesterday, but you're responsible for everything, but you need to review the difference between a genome and an ecomap. Okay, this is how we do, these are 2 ways to do family assessments. Okay, the genome is genetics. Just think of genes, genetics, family histories, you know, going back 3 generations. Does this family, you know, if we need to help, okay, for example, let me make this easy. I'll give you my own. 2 years ago, I was diagnosed with breast cancer. Have absolutely no breast cancer in my family. So we didn't know where it came from. So we went back and did some genome for 3 generations of my family to see if we could figure out if there was risk factors, hereditary risk factors, which I had none. Okay, so it helps clients, families understand some of their health risks that are influenced by their genetic makeup. So for me, I didn't have the health risks from a genetic makeup, but going through some other testing, we figured out where it came from and all that. But this, you look at, you know, families with a history of alcoholism, families with a history of heart disease, families with a history of cancer, families, these genomes are excellent tools as part of your family assessment. On the flip side, you have your ecomap, okay, which is the current status. Okay, so ecomaps are the family's connections with other social units. So how is the family connected in the community? Kids go to school, kids play sports, go to church, work, clubs, organizations, volunteers. Okay, ecomap represents a family's interaction with other groups and organizations. Is the family social butterflies, or are they kind of not hermit, but, you know, just very introverted? And the example I always give with the pandemic, as far as myself, is my ecomap before the pandemic was huge. I'm really involved in the community. I do a lot of things, whatever. What happened with the pandemic? And think about kids in school. Think about people at risk. What happened with the pandemic? Did everybody's ecomaps shrink to almost nothing? Right? Because we're all in lockdown. Right? Does that make sense? So that's an important part of family assessment as well. Okay, what priority things must a nurse do in order to evaluate the family? Okay, read through this. Okay, you need to know page 302, 18.5, home visiting safety tips for nurses. Position yourself between the client and the door. Don't bring a lot of money, valuables. Know your area before you're going in. Check in with your home health agency. These are all safety tips. And again, review Healthy People 2020 objectives. Okay. And then the last section was vulnerable populations and health risks. Okay, and that is chapter, let's see, that's another chapter that I want you to, I think it's 21. Is that it? Yeah. Okay, so focus on 21 as well. 21 is an important chapter, vulnerability and vulnerable populations. Okay, because think of community and public health. Most of what we're going to, a lot of what we're going to be dealing with in the community are vulnerability and vulnerable populations. Okay, what do we think of when we think of vulnerable populations? What do we think of? Homelessness? What else? What are you going to be dealing with as a community public health nurse as far as vulnerability?
The elderly and the young.
Yep. What else?
Teen pregnancy?
Absolutely. Mental
Addiction.
illness. What else?
Addictions.
Addictions. Absolutely. Okay. Vulnerable populations include homeless, mentally ill, substance users, veterans, migrant workers. Okay, this is important. Poverty is the primary cause of, based on this class, poverty is the primary cause of vulnerability. Okay, this is a nice little section right here. This is a nice little section right here on primary, secondary, and tertiary. So have a read through that. Really good synopsis. Okay. And then the last part of this talks about when intervening with vulnerable population, what does it look like? All right. Talks about setting reasonable goals, trying to establish trust, being able to determine what their risks are, what their support systems are, and being culturally sensitive. That's a lot of what's in the vulnerable populations chapter is our attitudes towards the vulnerable. I think that's the end of it. So I just want to, I think that was the end of it. Yeah. So one of the things that we talk about when we talk about being culturally competent, culturally sensitive, but how do you guys feel about the vulnerable populations? How do you feel about when you see homeless people? When you see extreme mental illness, substance abuse? I mean, are you able to, you know, what are your beliefs? What are your biases? What are your feelings? Because if we are in community health, public health, we are expected to care for vulnerable populations. And I mean, look around at your own community. How involved are you? That's what that vulnerable populations paper in week 9, that's doing week 9 is all about. Is finding a vulnerable population in your own community and doing a research paper. A lot of what we deal with in community nursing are vulnerable populations, right? The last thing I want to do, if we have time, which I think we do, and I didn't have time, I ran out of time with my last class, is there's a week 1 Cahoots. You guys know about Cahoots? Yes. There's a week 1 of the other instructors did a week 1 Cahoots and a week 2. me see if I can. Oh, I'm not really good at this either, so I'm gonna. Oh, the best I could do was copy the link. So
Can you send us the links to that for
yeah,
studying?
yeah, that's what I need to do. Yes. So
Okay,
put it in the
thank
chat,
you.
right? Let's try this. I'm gonna try it. So do we all just go in it?
I think you just have to click on it and get in it, and then you share the screen.
Oh, well, it says drum roll, please. The results of this challenge are in. See podium. How do you restart
That's
it?
probably, you have to do a reset or something on it,
How do
and then
do
you
a
can
re-
answer the questions again.
How do you do that?
Let me see. Hold on.
Well, you're trying to figure that out. Let's see if we can do. I don't. I didn't do the. I haven't done it yet. Week 2. Is that week 2? Let's try that.
Do you have the access code for that Zoom link?
No. Access code to
The Zoom.
the Zoom for Kahoot? Trying to get on this next one. Week. Okay. Did you guys look at the second one?
I'm not sure how to reset it, but you also have to give us the code to be able to play it.
I don't have the codes. I'll send it to you. How about that when I get them? An instructor just sent me the link. There was nothing about an access code or anything. So I'll send you for more practice. I'll send you the Kahoot. How's that? And you just can go through on your own, go through the questions. How's that? Will that work? What questions do you guys have? Was it helpful to go through the study guide like that?
Yeah, I think so.
What's your feedback?
It definitely gives us, some sort of topics to look at to make sure that we're studying, to re-overlook our PowerPoints. Look for those keywords.
Yeah. What else you guys thinking? Besides med surge 2?
Yeah. It's a little nerve-wracking this semester.
Yeah. Yeah. I hear that every single term because most of my
is.
students are taking the peds and med surge 2.
Yeah, that's what I'm taking. All
Yep.
3.
Yeah. Most of you guys are. And then for the, after exam 1, if there are a few people that don't do well, when I meet with them, they will consistently tell me, I really didn't focus on this class. I was more focused on my med surge. But you have to find time for this class. Not as much as med surge and peds, but you have to find time because you can't move on without passing this class, right? So I'm here to help. I'm here to help try and help guide you as to what I think would be the most helpful things to study, how to study, and go through the study guide. But if you know the study guide, if you understand it, you can articulate possible questions that might come out of the study guide and know your math. You'll be in the 90s. You'll do fine. But just don't blow off studying for the exam. Because you just don't want to get into hole after the first exam. You really don't. You're just playing catch up the rest of the term. So helpful? Anybody have any questions?
Will you let your colleague know that the link that she sent for the Kahoot was the end of their game? It's not actually the link to get in and start a game. It just showed the podium of who played her
Yeah.
game.
Right, that's what I got when I clicked on it. So
Okay.
if you guys want to hang tight, I'll try and go back to the, let's see. I'm gonna minimize you guys and, oh, I can't minimize without, you cannot minimize Zoom when you're recording. Okay, I'll try it a different way.
The one for week 2 worked.
It did?
It did. Yeah, you just click on it and it takes you right to the page and you continue as guest. But it worked.
Oh, well, you guys want to do week 2? It's up to you guys.
Hello, class. This is a recording for my Monday night class. I'm going to just briefly go.
Wait, oh my God, what did I just do? You guys all there? Well, now, why did I just hear Dr. Lundy's name?
Can you send us those links and announcements so that we can study them later?
Oh, good idea. But I have to get the correct links. But the week 2 is working, right?
I guess so. Yeah, I clicked on it again and that worked, but the week 1 is not.
Okay. Yeah, good idea. I will get, would you, okay, let me ask another question. Would you prefer I just send you the 2 links and you can do it on your own and give you 25 minutes of the gift of time? And you
I
can
do.
start
Yes,
going
please.
through the study guide?
That would be a blessing.
Would you guys want to do that?
Yes,
Yes.
please.
Will you promise me you'll do it?
Yes.
Yes.
Okay. And then in an announcement, I need to get the correct link for number 1, week 1. But yeah, if you guys would just take the time and go maybe read through your study guide now and see what, okay, I think I understand this part, or what I need to go back and look at it a little bit further.
Yes.
Okay, want to do that? I'm cool with that.
For the live thing, do we just put the date and time today?
Oh yeah, everybody pull up their attestation. Sorry. Everybody pull up attestation. We got to get that done. And I think I remember yesterday the questions were, what is primary, secondary, and tertiary, and give an example of each. I'm going to stop recording at this point. Are those the two?